So hello everyone. So today we shall be discussing about a small topic, that is differences between endophthalmitis, which is infectious endophthalmitis, and toxic anterior segment syndrome, which is in short known as TASS. So nature, infectious endophthalmitis is caused due to infections due to either bacterial or fungal. But toxic anterior segment syndrome is caused by non-infectious etiology, like retained lens matter after cataract surgery, intraocular lens, or some antibiotics, or some bacterial endotoxins. No, so these are the This is the infectious etiology, but non-infectious mechanism. So the toxin will lead to toxic anterior segment syndrome. It is purely an inflammatory reaction where you have infection that will elicit an inflammatory response. This is purely a chemical reaction where the chemical matter will cause damage, and it can also lead to inflammation. So it is variable. Next, important one is onset. So infection takes time to develop after the inoculation. So it takes 3 to 7 days. It takes half to 2 days. You can remember half to 2. Pain. Infection will have marked pain. Toxic anterior segment syndrome, the patient will have either minimal pain or no pain. Visual acuity will be severely reduced. So toxic anterior segment syndrome, it is variable based upon the etiology. Corneal edema will be mild. But in toxic anterior segment syndrome, this is the most important point. You will have limbus to limbus corneal edema from one side of the limbus. So you have the eye, you have the cornea. So from one side of the limbus to another side, you'll have extent of corneal edema. Then lid edema. Here it will be marked lid edema. Here you will have mild lid edema. Conjunctiva. Conjunctival chemosis and circumcorneal congestion. Here conjunctiva will be normal. Pupil. So all these are inflammatory markers. So inflammatory markers are more pronounced in infectious endophthalmitis. Now pupil here in infectious etiology it is variable, but in toxic anterior segment syndrome it is dilated, irregular, and not responding to any kind of light stimulus. So you'll have some static pupil. Then intraocular pressure, here it is variable, but here it is elevated because the chemical matter, they block your trabecular meshwork. The trabecular meshwork will be there, no, in the angles of eyes. So that will be blocked. Anterior chamber, when you see anterior chamber, the reaction will be less intense. Here it will be more intense because of the chemical reaction and chemical damage. So fibrin content will be variable in the anterior chamber. Here you'll have lot of fibrin because of the chemical reaction, the things getting released. Hypopyon is the pus. The pus will be settling down. So if you see the anterior chamber, the pus will be settled down in form of a like this. In a crescent shape, the pus will be settled. That is called hypopyon. So that will be more pronounced in infectious endophthalmitis more than toxic anterior segment syndrome. Next is your cells. You will have a lot of cells in infectious endophthalmitis. Why? It is an inflammatory reaction. So it involves lot of WBCs. Here also cells are there, but they are comparatively less. So posterior segment or vitreous involvement, always it will be there. Endophthalmitis, right? But in toxic anterior segment syndrome, mostly anterior segment is only involved. Posterior segment is not at all involved. Very, very rare. So coming to the management, the prognosis of infectious endophthalmitis is poor because whole of your globe, inside the globe, the eyeball gets affected. Not the globe. Globe is involved. When the globe is involved, you call it as panophthalmitis. Then toxic anterior segment syndrome, only anterior segment is involved. So mild treatment will be helpful and good prognosis will be there. So treatment of infectious endophthalmitis, multimodal. So mostly you'll give antimicrobial to treat your bacterial and fungal etiology. And multimodal, you may add steroids or whatever needed things according to the pathology, pathogenesis, and clinical features you see. In toxic anterior segment syndrome, you mostly give steroids to control the partial inflammatory reaction which is occurring. Thank you so much.